One morning begins with a pounding migraine. You swallow an analgesic, sip cold fluids, then get back to daily routines. Whole duration spent, perhaps 40 seconds. Just picture waking up with this identical migraine 50,000 years past. Zero drugs, zero drugstore, zero physicians, zero web pages to overanalyze symptoms with 17 obscure medical conditions. Only yourself, your agony, plus a den full of neighbors who remain totally ignorant regarding what's occurring within that brain. That's the reality nobody ever thinks about. Mankind didn't possess advanced medicine for 99.9% of its timeline. But still somehow, despite completely impossible odds, we endured long enough to create hospitals, medications, plus the capacity to complain regarding hospitals and medications on social media. So, how did early humans actually manage it? How did they heal injuries, illness, infections, fractured bones, deliveries, plus every other biological catastrophe the human frame is capable of generating with literally nothing we might recognize as medicine today? This truth is weirder, highly impressive, and frankly more unsettling than you likely expect. Because it turns out ancient people weren't just stumbling around hoping for the best. They kept experimenting, watching, and building real medical knowledge thousands of years before anybody thought to write things down. And some of what they uncovered, we're still using it right now. This morning, in your bathroom cabinet. This is the tale of how humanity figured out healthcare by learning absolutely everything the hard way. Let's begin at the absolute beginning, which in this context means somewhere around 2 million years ago, when early hominids were far more interested in not getting eaten by giant predators than in developing a healthcare system. Ancient primates almost certainly depended on the same basic instincts every creature does when wounded or sick. Rest, clean wounds, skip meals, seek warmth. Observe a dog post-surgery, and you're essentially viewing a behavioral blueprint that stretches back millions of years. These aren't learned activities. They're biological defaults, and they help, at least for minor troubles. But here's where things get fascinating. Somewhere along the timeline, our ancestors started doing something no other animal does consistently. They started intentionally applying plants. We know this because chimpanzees, our closest living relatives, already do so. Apes have been documented seeking out and consuming specific herbs when sick. Herbs they don't normally eat, and clearly don't enjoy eating. They'll swallow coarse foliage that physically purges parasites from their digestive tracts. They'll gnaw bitter bark from trees that contain compounds toxic to the exact parasites harming them. They're not eating this for the taste, they're doing it because it cures. And somehow they puzzled this out. If primates have this ability, there's solid reason to assume early hominids had it too. In truth, they likely had it better, because humans have something apes lack in large quantities. The ability to share information across generations, to teach and learn, to accumulate knowledge over time, which implies the very first medicine wasn't invented. It was noticed and then remembered, and then passed on. That difference matters more than it appears. Any creature that eats a shrub and feels better displays a useful trait. A human who eats a shrub feels better and then tells everyone else about it starts the beginning of a medical tradition. One discovery, shared at the right moment, might save dozens of lives over the subsequent generation. And those individuals would share it with the next generation, and on, across thousands of years, until a pool of wisdom existed that no single person had created, but that everybody benefited from. That was, quietly and without any fanfare, the birth of medicine. Now steady yourself, since what follows here remains one of the most remarkable breakthroughs within the whole field of archaeology. In 2023, scientists excavating inside a cavern across Borneo discovered something that stopped them cold. They were analyzing a skeleton dating back roughly 31,000 years, and this skeleton was missing parts of its left limb. Not because it degraded away over time, but it had been surgically amputated. The slice was pristine. The bone had regenerated around the injury, which means the patient didn't perish immediately. They lived. A clinical amputation executed 31,000 years ago. Before farming, before writing, before anything we associate with civilization. Let that settle in for a moment. Somebody 300 centuries ago stared at a victim with a terribly mangled leg and decided we ought to chop this off, and then they did it. And the subject lived probably for decades afterward in a jungle on one leg during the Stone Age. This revelation completely rewrote whatever experts thought they understood concerning prehistoric medicine. Prior to this discovery, the oldest confirmed amputation was only several millennia old. Today we're reviewing complex surgical operations being completed throughout the Ice Age using flint tools alongside obvious success. And this wasn't a fluke. Throughout excavation sites globally, we discover skulls bearing holes in them, carefully bored-shaped holes, not from violence, but from a surgical procedure called trepanation, which involves extracting a section of the skull, supposedly to relieve pressure, cure seizures, or treat head trauma. The truly crazy part, a significant number of the patients survived. We know because the bone grew back around the openings. Humans endured cranial surgery during the Stone Age using flint, and many of them remained completely fine afterward, which poses an obvious question. How on earth did the surgeons learn to do that? How did they know it would work? How could they know exactly what to do without killing the sufferer on the spot? The honest answer is, we have zero clues. What we do know is that they puzzled it out somehow through a process of observation and experimentation that we can barely fathom. Because most of those early trials probably ended poorly. There existed no ethics board. There existed no peer review. There remained only someone willing to try, a sufferer desperate enough to allow it, plus the slow, brutal accumulation of data regarding what succeeded and what immediately made situations catastrophically worse. The reality that trepanation became a widespread, practiced procedure across multiple unconnected cultures on different continents suggests it worked often enough to be worth repeating, and that is in its own grim way astonishing. Somewhere amidst realizing that willow bark relieved acute pain and comprehending that it holds a substance chemically akin to aspirin, there sit roughly 5,000 years of humans chewing on stuff and seeing what transpired. And this is where early medicine gets genuinely spectacular. Excavation data proves that Neanderthals, who were not even fully modern beings, were already utilizing medicinal plants. Digs around Shanidar Cave within Iraq uncovered pollen deposits from various healing plants near a Neanderthal burial site dating back 60,000 years. Whether those flowers were deliberately placed there remains debated. Yet other Neanderthal sites have produced direct proof of plant usage, including residues found within dental calculus, which is basically fossilized plaque, demonstrating that they were eating vegetation possessing known medicinal properties. Yarrow, groundsel, herbs still utilized in traditional healthcare today. By the time we hit ancient Egypt around 3000 BCE, the medical knowledge base was frankly unbelievable. The Ebers Papyrus, penned around 1550 BCE, though containing wisdom far older, catalogs over 700 remedies using hundreds of distinct plants, minerals, and animal products. It outlines treatments for swelling, infections, digestive issues, skin conditions, eye ailments, and psychological disorders. Some of these therapies were genuinely effective. Honey, which they applied broadly during wound management, remains a real antimicrobial agent. We know this today. It functions since its low moisture levels, acidic pH, and hydrogen peroxide generation create an environment where bacteria cannot easily thrive. The Egyptians didn't understand this mechanism, yet they had noticed via direct observation that injuries treated with honey healed better than those that weren't. Garlic, which they also consumed extensively, and which laborers building the pyramids supposedly ate in enormous quantities, possesses real antibacterial and antifungal properties. Whenever early healers prescribed garlic for infections, they were accidentally doing the correct thing. Willow bark for aches and fever, aloe for burns, opium poppy for pain relief, which the Egyptians utilized, and which functions because of the opioid receptors inside our brains that nobody knew existed for another few thousand years. These weren't merely lucky guesses. They embodied thousands of years of gathered empirical observation. Nobody knew why these items worked, yet they knew that they worked, and such knowledge was considered precious enough to be written down, preserved, and handed down. And here's where the narrative becomes almost poetic. The folks who possessed this knowledge, the healers, the shamans, the midwives, the herbalists, were among the most vital members of any ancient community. Not because they were always correct, but because they became the repository for everything the community had learned regarding staying alive. Losing such wisdom to disease, violence, or the simple failure to teach it to the next generation could mean a society that had survived for centuries suddenly losing the capacity to treat a wound that became infected, or a fever that needed managing, or a delivery that was going poorly. Knowledge meant medicine, and medicine meant survival. Here's the detail that puts the whole story into perspective. Germ theory, the concept that infectious diseases are caused by microorganisms, wasn't established until the 1860s. Before Louis Pasteur and Robert Koch did their research, nobody on Earth understood what actually triggered most of the diseases that were killing populations in massive numbers. Not anybody. Throughout all of human history, which implies every single medical tradition that existed before the mid-19th century, was operating without the most foundational piece of data needed to understand illness. They knew nothing regarding bacteria. They knew nothing regarding viruses. They didn't realize that the reason a wound became infected was because microscopic organisms were colonizing it and multiplying inside the tissues. Instead, they held alternative theories. Greeks thought sickness stemmed from imbalances across 4 bodily humors: blood, phlegm, yellow bile, and black bile. Falling ill meant one of these was out of proportion, and treatment meant bringing them back into harmony, which is why bloodletting, the practice of intentionally draining blood from a patient, remained standard medical practice for over 2,000 years, and probably killed more patients than it ever cured. The Chinese utilized a framework based on vital energy flowing throughout the body. Ayurvedic medicine within India operated with the concept of doshas. Practically every civilization developed its own internal model regarding how the body functioned and what occurred when things went wrong. None of these paradigms were accurate in the way we comprehend disease today. And yet, here's the intriguing part. Several of the treatments derived from these flawed models worked anyway, because ancient healers were empiricists before they were theorists. They watched, they experimented, they retained what worked and abandoned what failed. The hypothesis might be completely wrong, yet the prescription sometimes landed on something real by accident. Fungus has been documented in ancient Egyptian medical contexts, with preparations containing mold applied to infected wounds. Fungus that produces penicillin. Early healers utilizing primitive antibiotics without knowing what antibiotics were, 2,000 years before Alexander Fleming noticed the same effect and won a Nobel Prize for it. The model was wrong, the result was right, and that, when you think about it, remains a genuine achievement for people who had zero ways of seeing what was actually happening at the microscopic level. Let's discuss physical trauma, because this is where ancient medicine yields its most direct, immediate, and well-documented results. Fractured bones heal on their own if immobilized correctly. This is not complex medicine. It demands only the realization that if you keep a fractured limb still and supported, it knits back together. And the archaeological record demonstrates that ancient humans were doing exactly this as far back as we can see clearly. We possess Egyptian mummies with healed fractures that display evidence of splinting. We possess Greek texts detailing fracture management in remarkable detail. We possess Roman surgical instruments excavated from sites across Europe that are recognizably similar to tools surgeons were using in the 19th century. Combat medicine in particular drove enormous advances in surgical technique throughout the ancient world. The Roman military was arguably the most medically sophisticated fighting force across the ancient world. Not because Romans were especially enlightened, but because keeping soldiers alive remained a practical military necessity. Roman legions employed trained medics. They built field hospitals. They employed surgeons who specialized in extracting arrows and spear points, cleaning and closing wounds, plus managing the inevitable infections that followed. Roman military medicine was likely the most advanced trauma care system the world had seen up to that point, and its techniques remained largely the standard for over 1,000 years after the empire fell. But here's the element that doesn't get talked about enough. Survival throughout the ancient world was fundamentally a group project. Solitary humans are not well designed for surviving alone. We boast no claws, no armor, no exceptional speed. We're slow to mature, fragile when injured, and dependent upon others for care when sick or hurt. The biological reality remains that for most of human history, if you became seriously injured or ill, you survived because other people helped you, and those people possessed knowledge, specialized knowledge accumulated across generations, held by individuals who had dedicated their lives to healing. Mystics, healers, midwives. The people in every community who knew which plants did what, who could set a bone, who understood how to handle a difficult birth. These were not savages guessing randomly. They were specialists, practicing a tradition, operating within frameworks that, despite all their theoretical flaws, were built upon real observations of what actually worked on real human bodies. This social fabric was itself a type of medicine. Isolation is terrible for recovery. We know this scientifically today. Early humans knew it practically because sick people who were cared for by their community survived at higher rates than those who weren't. And societies that recognized this and built care into their social structure outcompeted those that didn't. Evolution doesn't solely select for bodies, it selects for behaviors. And caregiving, it turns out, was selected for quite heavily indeed. Let's be truthful about something. Ancient medicine saved a ton of lives. It was genuinely impressive in numerous respects, and it also failed catastrophically on a regular basis, in ways that we have largely eliminated from modern life, and mostly forgotten to feel grateful for. Childbirth remains the most obvious example. Before modern obstetrics, giving birth was one of the most perilous things a woman could do. Maternal death rates in pre-modern societies ranged from roughly 1 to 3% per birth, which sounds small until you remember that women typically gave birth multiple times. Over a lifetime, the cumulative risk of dying during childbirth was substantial. For much of human history, a significant fraction of mothers died in the process of giving birth. Infant mortality was even more severe. In many ancient societies, half of all children born would never survive until their 5th birthday. Not because folks didn't care, not because they weren't trying, but because infections, malnutrition, and illnesses that are now either preventable or treatable were simply part of the landscape of childhood. Fever offers a good example of both the limits and the ingenuity of ancient medicine. Fever itself is actually a helpful immune response, which some ancient healers intuited. Egyptian and Greek medical texts both describe managing rather than eliminating fevers in some cases, allowing it to do its work while keeping the patient hydrated and comfortable. But when fever stemmed from serious infection, particularly sepsis, the systemic infection of the blood, there was essentially nothing that could be done. Sepsis killed swiftly and completely. It still kills victims today, despite antibiotics and intensive care units. Without those tools, it was almost always fatal. What ancient humans provided in these cases was what we might generously call compassionate care, keeping the sufferer warm, giving them water, administering whatever herbal preparations might reduce discomfort, being present, not abandoning them. And sometimes the immune system triumphed anyway. The human frame is remarkably capable given half a chance. We are, when everything else is stripped away, extraordinarily well-designed machines for surviving threats that should kill us. Our immune systems are complex. Our capacity for tissue repair is remarkable. Our psychological resilience, when supported by community, is genuinely astounding. Ancient healers couldn't always fix what was wrong, but they created the conditions: physical comfort, social support, herbal assistance, reduced stress, that allowed the body's own systems the absolute best chance of doing the job themselves. That means something significant. In numerous cases, it meant everything. The truthful picture of human health before modern medicine involves one of genuine hardship, real ingenuity, and constant negotiation with a body that is simultaneously incredibly resilient and startlingly fragile. People perished young. They died from things that wouldn't kill anyone today. They suffered from ailments that could now be cured via a single course of antibiotics. They endured chronic pain that we would consider unacceptable by modern standards. A severe tooth infection could kill you. A minor wound could turn septic within days. A chest cold might turn into pneumonia with nothing to stop it. Delivering babies was a genuine gamble. Surviving childhood was a massive achievement. Living past 50 was, in many eras and places, a notable accomplishment. And yet people achieved all of these things. Communities survived. Populations expanded. Civilizations were constructed by people who were by our standards medically completely unprotected because they possessed knowledge. Flawed, sometimes dangerously wrong, but also sometimes brilliantly correct. They had society. They utilized accumulated observation. They held the specific hard-won understanding regarding their local environment. Which plants grew nearby that helped? Which animals could be used for? What signs indicated recovery was coming? And what signs meant preparing for death? They also possessed something that is easy to underestimate: remarkable psychological fortitude. Any culture where death and serious illness are constant features of everyday life develops a relationship with those things that is fundamentally different from ours. Not callous, not indifferent, but clear-eyed in a way that we, living within an era of extraordinary medical protection, genuinely struggle to imagine. That ancient healer sitting cross-legged with a stone mortar grinding medicinal herbs, whispering knowledge down to an apprentice who will whisper it down to another across thousands of years and thousands of miles, was not doing something primitive. They were conducting science in the oldest sense of the word: observation, hypothesis, testing, revision, preservation, regarding what worked. The difference between them and a pharmacologist inside a modern lab is not the quality of the thinking. It's the equipment, the accumulated knowledge base, and the extraordinary privilege of knowing what a bacterium is. Here's the detail that might genuinely surprise you. A significant portion of the medications used in modern pharmaceutical medicine are derived from plants, or are synthetic versions of compounds originally found in plants. The World Health Organization estimates that roughly 80% of the global population still relies primarily on plant-based medicine for their primary health care. Not because they don't know about modern medicine, but because that's what's accessible, and because much of it genuinely works. Aspirin originated from willow bark. Morphine originated from the opium poppy. Quinine, which saved countless lives treating malaria, originated from the bark of the cinchona tree, used by South American indigenous peoples for centuries before Europeans arrived and wrote it down. Artemisinin, one of the most effective modern malaria treatments, was derived from sweet wormwood, a plant utilized in Chinese medicine for 2,000 years before anyone isolated its active compound. Digoxin, prescribed to treat heart failure, originated from the foxglove plant, which folk healers across Britain used for heart conditions for centuries before William Withering formalized the treatment during 1785. Taxol, one of the most important cancer drugs in modern medicine, originated from the Pacific yew tree. Vincristine, prescribed to treat childhood leukemia, originated from the periwinkle flower, used in traditional medicine across Madagascar. This ancient pharmacopoeia, the accumulated knowledge regarding which plants affected the human body and how, built up through tens of thousands of years of empirical observation, represents a genuine scientific resource. One that modern pharmacology has been methodically extracting for decades. One that ethnobotanists argue we are destroying alongside the rainforests and the indigenous communities who hold the last living fragments of such knowledge. When we dismiss ancient medicine as superstition, we miss the part where modern medicine is standing upon its shoulders, quietly grateful, and occasionally not giving nearly enough credit. Early humans survived before medicine because, in a very real sense, they invented it. One painful trial at a time. One observation passed down to one apprentice. One wound treated with honey because somebody 100 generations earlier had noticed that honey helped. One fever managed using willow bark because the knowledge had traveled somehow across thousands of miles and thousands of years to the person who needed it. The chain remains unbroken. From the Neanderthal chewing bitter pith in a cave 60,000 years ago, to the Egyptian physician pressing a honey-soaked dressing to a wound, to the Roman army surgeon pulling an arrowhead from a soldier's thigh, to the Chinese physician prescribing sweet wormwood for fever, to the laboratory where a researcher is right now testing a compound initially identified in a plant used by a community that has known about it for centuries. It's all the same thing, the same impulse, the same project, trying to understand the body, trying to keep it alive, passing on what succeeds. And if any of that made you feel slightly better about the ibuprofen you took this morning, excellent. You're standing at the end of a very long line of individuals who were trying to solve the exact same problem you faced. They simply had to do it the hard way first, so the rest of us wouldn't have to. Tell me down in the comments what video you want me to produce next. See you later.